I'm Courtney Keeler, and I am in the public health program and the MPH program. I work in both the BSPH, the bachelor's program, and the MPH, the graduate program. My background is lately in tobacco control research. So I do a lot of research on Proposition 56. So that was a proposition in 2016 that raised the taxes on tobacco, implemented a $2 excise tax on tobacco and tobacco equivalent products. And so a lot of my work is looking at not only the impact of that proposition, but also disparities in the impact. Is it that certain groups, be they low income or different racial and ethnic groups, do they experience the proposition differently, the impact of that taxation? I'm actually just starting a project looking at the rural effects of Proposition 56, which I'm really excited about. I do a lot of work with adolescent health as well. So I'm on the editorial board of the Journal of Adolescent Health, and that's a fun way to marry my previous work as a graduate student with adolescent health with my current work with tobacco control. So my background is in those areas. Educationally, I got my degree at UNC, both my master's degree in economics and my doctorate degree in public health, in health policy and management. So I try to bring in a lot of those things into my work. Also, kind of along the same lines, I'm very passionate about teaching, and that's manifest in a lot of the research I do on statistical education. A lot of the articles that I've published with Dr. Alexa Curtis, who is now at UNR, relates to how can you make things that seem so tricky and hard and arcane accessible and approachable. And so we have tackled that subject in a series of articles. I think thinking about making teaching and statistics accessible, the role of empathy in education, those are another research area that I'm involved in. So I'm doing a lot of statistical consulting with folks within the SONHP community. A lot of DNP students, a lot of PsyD students are coming, and I have these open office hours, and they come and talk about their projects, what's going well, questions that they have, and it really is about empowering the students so that they can tackle the topic, because oftentimes students come in and they're like, I don't know, but it's really not a scary thing. I think it's just about kind of answering clarifying questions, kind of pointing them in the right direction, explaining things in a way that makes sense. And so it's just been, fun to work with them, and also for me to learn about the work that nursing students and PsyD students are doing, because it's absolutely fabulous. So I think that is also reflective of not only my research, because I do research with a lot of folks, who aren't necessarily in public health, but also just public health itself is this real interdisciplinary kind of field where you have this huge tent with people from all these different backgrounds, and you really do need that team, that collaboration to succeed. And so it's been nice to kind of build those bridges across programs by, working with students and faculty in this capacity. Yeah. I think when thinking about what is our role in health policy and thinking about like the public health practitioner, I think it's thinking about, I think a lot of people would give different answers to that question. For me, I think it's thinking about, who's most adversely affected, who's most disproportionately impacted by something, and how can we use our research, our voice, our positions of privilege to raise those folks up to affect better health outcomes, affect positive change. So for me and my role in doing tobacco control research, there remains, huge disparities in tobacco-related disease. So we've had this generally really high success rate with California. It's called a comprehensive tobacco control program. We've had this very, very successful tobacco control effort in California, but certain populations still continue to disproportionately be impacted by tobacco use, be it minority populations, be it lower income populations, be it rural populations, and thinking about how can we really raise those groups up to really affect positive change, to kind of ameliorate or try to ameliorate those observed disparities. I think for me, and this is kind of a nerdy answer, I love data. I love that I can not just think of a question. So like, right now I'm looking at this MEPS data. It's this really great data that's publicly available. It's about medical utilization and expenditure. And you can like think about what a question is. So I'm interested in mental health and dental expenditure. And I can go into that data and look at all these data and start kind of answering questions. So I love the ability to use this theoretical framework that public health provides and then dive into the data to try to begin to answer those questions. I mean, unsatisfyingly, in trying to answer questions, more often than not, you don't fully answer the question. More questions emerge, but I love that piece of the process. I love that aspect of public health. I was trying to think about what like an aha moment was for me. And I was sitting there thinking, I was like, oh my gosh, I know what it is. So I actually started, my undergrad is in economics, and I actually started in an econ PhD program. And I got through like my introductory classes, and it was time to start thinking about my research and my dissertation and what I wanted to do. And I was really, really interested in adolescent health. I was interested in mental health, and I was interested in substance use and how that kind of all related together. And I was having such a hard time finding support, finding people who were interested in what I was doing. And someone said, you've got to talk to this guy named Jonathan Oberlander, who is this health policy guy, really, really, really smart. And he set aside an hour just to talk with me. And it was in that conversation that I realized, I really love economics, but public health was where I needed to be. And, this conversation resulted into this transferring from economics to the School of Public Health and a new advisor and a new field. But it was like what I had been doing, kind of trying to muddle through on my own. It turned out there was this whole field. And that's kind of what I try to create for students as well. Knowing the generosity of time that people gave me, I try to create for them so that they can also have their aha moments in our program, this realization or passion that not only what they want to do is possible, but they are more than capable. They're empowered to do it. But I think it's also worth thinking about how we interact with one another and our approaches in the classroom and with our colleagues. And I really love collaboration. I like to bring empathy and humility to the table, realizing that we all have something that we bring and to celebrate one another. And I love that aspect about my work here, about my work with my colleagues. And if you're interested in that, if that resonates, come work with me. I'd love to. I'd love to work with you.